Welcome to the Gilman Wolsey podcast. This is episode number 15. I am your host, Gilman Wolsey. Today we're going to be talking about looking at numbers and trying to make sense out of all of this. As I've been talking to a bunch of people, family members, friends, colleagues, it's interesting to see how there's a lot of confirmation bias out there. Everyone has the perspective that they want to believe very desperately, either for the positive or for the negative, because that's what they think is true. And so they're definitely looking for data and studies and reports that confirm what their thoughts are. The first thing I want to say is that whenever there's any sort of situation, you have to be very, very careful of how you look at the data and realize that data can be used to prove something in one direction or the other. Or I shouldn't say prove it, but lend credibility that, something is one way or it's another way. One of the things that has been really apparent to me lately is how the Diamond Princess cruise ship has been used inappropriately. So a lot of news organizations out there and other pundits are saying that the death rate on the Diamond Princess was 1%. Now, first of all, this disease lasts for a very, very long time. We know this from the data that we've received from the Asian countries that have been dealing with this for longer than we have. Typically, it takes months for a significant proportion of the population to go all the way through this illness, from initial infection to, either recovery or hospitalization. If people are put on the ventilators, they are on the ventilators for a very long time, usually 20 days plus, before they're able to get off of those ventilators. And what happens at some point in time, people's attention is lost and they just move on. So for instance, with the Diamond Princess cruise ship, what happened is there was 7 deaths that occurred there early on, and then people their attention was lost and they moved on and stopped paying attention. But in the meantime, since that happened, an additional 3 people have died. So now there are a total of 10 people that have passed away from the Diamond Princess cruise ship. But there's another important factor to take into account. There's still 15 people that are listed in serious or critical condition from that particular cruise ship. And it could go either way with those people. But what we do know for certain is the longer that someone it takes to recover from the illness, the more likely they are to have a bad outcome. Healthy people are going to recover faster. The longer, say, you're intubated or ventilated, the more likely it is that you're not going to be able to recover from that illness at all. So all we can really say from the Diamond Princess is that at a minimum, 10 people have died, which is approximately a 1.5% death rate. And at maximum, 25 people will ultimately die. And that, is going to be a much higher death rate, over 3%, 4% plus. But the thing that I want everyone to take a look at is the entire time that has taken since the beginning, when people first started getting infected on the Diamond Princess, to today, we still don't have an answer. And over half of the people that could potentially die are still outstanding, and we don't know if they're going to make it or not. Let that really sink in, because there is so much that is unknown about this disease right now that people are projecting a lot of outcomes, but our first really good kind of self-contained experiment, which is the Diamond Princess, still hasn't, given us a clear answer for what the final outcome for that's going to be. So with this particular illness, there's lots of reasons that it's really, really hard to evaluate the data, and you have to be really forward-thinking in how you look at any information or any story that someone is telling you. When you look at the course of this disease, it's usually taking about 5 to 10 days for people to first experience symptoms. After they experience symptoms, it's taking another on average about a week for a lot of them to get into trouble. And then if they go to the hospital and they end up on a ventilator, it's taking 20 plus days. So as we've described before, the entire course of illness for the average person lasts, 4, 5, 6 weeks. And so all of the information that you see coming out, people are trying to report all sorts of different things. For instance, I'm seeing the number of discharges from New York City hospitals. I'm seeing the number of intubations. I'm seeing the number of admissions. I'm seeing the number of deaths. So you have to ask yourself, is the information that's being reported, is it showing what the person says it to show? Yesterday, when I was watching one of the news programs, they were talking about the number of discharges from New York hospitals and how this was a positive sign because, it shows that a bunch of people are getting better and a bunch of people are leaving the hospital. But the real question I have when I looked at that is, well, how many admissions are there? And is the census or the number of people in the hospital with coronavirus increasing or decreasing? So as one would expect, if the number of people going to the hospital is increasing, say that you have double the normal amount of admissions, well, of course you're going to have an increasing number of discharges as well, because if more people are going into the hospital, you're going to have more people coming out of the hospital. But are those people collecting inside the hospital? Are the hospital wards filling up? Does the hospital even have the capacity to take on more people? What's the number of intubations? Maybe intubations is going up. Maybe intubations is going down. What's the death rate? But when you look at these different statistics, ask yourself, what could be causing these besides what the person is telling me that's causing them? In general, news people are not terribly analytic individuals. I say this not having known them personally, but by listening to the discussions that they're having and how they're interpreting different sets of numbers. While we're talking about numbers, I also want to discuss data models because we're hearing all sorts of discussion about, this model projects, something. This other model projects this other thing. There was a model early on out of the United Kingdom that said there was going to be 500,000 people in the United Kingdom that died. Then they came out and said, well, this person has changed their model and now they're only showing 20,000 people in the United Kingdom are going to die. Realize when it comes to models, what parameters, what you choose to put into the model determines what outcome you're going to have or what projection you're going to have from the model. If you change the inputs, if you change the data that you're assuming at the beginning, it's going to dramatically change the outcomes that you're observing. But we have to make a lot of guesses with models. That's the problem with models, is that we assume things that we actually don't know at this point in time. For instance, between the big estimate in the United Kingdom of 500,000 people dying and the low estimate of 20,000 people dying, one of the big assumptions that they changed was that there was a very large number of individuals in the population that had been previously infected but had never shown symptoms. So whereas they had thought initially that almost no one was an asymptomatic person that had previously had the illness but did not have enough symptoms to actually show up, in the new revised model, they changed that assumption and they assumed that there were a whole bunch of people that had had the infection that had never shown up. That was one of the major reasons that there was all of a sudden this dramatic shift in how they viewed the number of people that were suspected of dying in the United Kingdom. Right now, we don't have good, reliable data to actually prove that point, that more people have had the infection than have got seriously sick, and so we simply don't know about it. What we do know is that they are developing serologic tests to be able to look and see if people are already immune to the illness, meaning that they had had it in the past, whether or not they had severe symptoms. And once we have that test, then we can actually collect that data to determine if that assumption is true or not. If it is true, then the lower model, 20,000 people, dying in the United Kingdom is more likely to be accurate. If it turns out that not a lot of people have previously been infected, then we're actually stuck with the bigger number. We would expect that the risk is, up to 500,000 people could die in the United Kingdom. One of the things that has been something between interesting and frustrating to me personally to watch is the news briefings from the coronavirus task force. It seems to me, or at least the message that I've got over time, is that they've kind of waffled back and forth on the severity of this illness. Their models seem to be fluctuating somewhat over time. There's periods where they talk about, this isn't going to be as severe as we thought it was going to be. And then, we turn around, days later, and all of a sudden the projections again are for, substantial number of deaths. The total that I'm hearing today is that if we had done nothing, that the number of deaths would have, reached or exceeded 2.2 million people. So when it does come to models, realize that they are very, very speculative. Basically, they're educated guesses. But as we get more and more information, and as we kind of learn more and have more knowledge from actual data that can be collected, then we can project much, much better. But right now, we are still in the very, very early phases of this illness, and it's impossible to actually have good data yet. The point about the Diamond Princess earlier was kind of illustrative of this. With the Diamond Princess, that happened, there was like 40 cases in the United States when everyone on the Diamond Princess that was going to become infected was already infected. And now we have, 130,000 cases today. The Diamond Princess still is not resolved. We don't have a complete data set from the Diamond Princess until every single person that became infected has either recovered or they passed away. So just keep that in mind anytime you hear someone discussing, with a high degree of certainty that they know what's going to happen. Right now, there is no single person out there that knows with a high degree of certainty what is going to happen. There's so many variables at play, and we don't even really know the true degree of, how many people on average, die from this particular illness, let alone, how quickly it spreads and all of that. As we kind of play with the illness, if you will, as we do things like quarantines and travel bans and, possibly new treatments coming online and stuff like that, all of those models start to shift because we're changing the input parameters. We're physically altering the normal natural processes that this disease would spread by. I wanted to talk a little bit as well about a topic that you're hearing quite a bit about, and that's masks. So when it comes to masks, I'm kind of interested to see where the policy of the United States is going to go. You have heard the National Health Director and other people come out and say that masks are ineffective. But the thing is, we know that in China, that they have recommended that everyone wears a mask, both people infected and people not infected. Right now, as we speak, Wuhan is starting to open up a little bit, but it is my understanding, and from photos that I've seen, every person that is out in public is required to wear a mask. Masks certainly are not 100% effective in preventing the transmission, but if the entire population is wearing masks, it's going to help prevent people that are infected from, say, coughing on a surface and spreading the illness. And it's also going to help prevent people that are not infected from picking up, things, touching their face, touching their mouth, and then exposing themselves to the illness. One of the other kind of off therapies that I wanted to bring up, although kind of in our current medical system, this is not politically correct, and it's certainly something that would never be considered unless the situation was very dire and they were looking for, I guess, the least, palatable solution to prevent the spread of this is something in medicine we call variolation. So what variolation is, we take or a sample of the infection, we could purify it, whatever you wanted, and then we give very, very tiny doses intentionally to people. What this allows your body to do is to deal with the virus on terms that are more favorable to you personally. We have evidence to support that the higher the dose of virus that you get initially, the more likely you are to do poorly with the disease. So, healthcare workers in particular seem to be more at risk because in the healthcare setting, dealing with sick people, dealing with intubation where they stick a breathing tube down into their throat, all of these things tend to have high volumes of air that contains bacteria and viruses that can transmit infection to people. And the idea behind variolation is that instead of giving the virus the upper hand by having an extremely large number of virus particles that your body has to try to fight against early on when your body doesn't have good immunity, in fact, your body has no immunity to it, that we introduce a very, very, very tiny dose with the hopes that, your body, your immune system has the upper hand of, trying to tackle this without being overwhelmed by a very large number of virus particles. So variolation has been used in the past to deal with other diseases, but it has fallen out of favor probably within the last, several hundred years as we've developed vaccines and other, methods to deal with illnesses. The problem with variolation is that a certain number of people will develop severe illness, and certainly there would be some mortality or death associated with giving someone the infection intentionally. With other illnesses, variolation could result in a dramatic decrease in the number of deaths, but it never entirely eliminated the number of deaths. And that's why, in general, people are opposed to even, talking about variolation. But for completeness, I think that, we have to look at every option available across the medical spectrum. In fact, when I was growing up, parents would kind of practice a form of variolation on their own. Basically, when one child in the community would get chickenpox, it wasn't uncommon for parents to have a chickenpox party where all the kids would get together and they would play so that all the kids would get infected with chickenpox. They would deal with it kind of in one batch of people, and then everyone would get better and everyone would move on with their lives. Certainly, back in that period of time, before there was a chickenpox vaccine, chickenpox is so highly infectious that every parent expected that eventually their child would get chickenpox anyways, and so it was better to deal with it young. Also, chickenpox tends to be less severe for whatever reason when people contract it when they're young than if they contract it when they're older or adult. One of the other things that has been raising a little bit of concern with me as well are some early indications that disease may be more severe in close contacts of people that get sick versus people that acquire it in the community. This is essentially the same effect that we're seeing in healthcare workers, in that it's a factor related to the size of the exposure that you have. If someone picks up the virus in the community, chances are it was a very brief contact type exposure of a relatively low dose. If someone contracts the disease from a loved one inside their family, chances are they're in the same living space, and the amount of virus exposure that person has is going to be much, much more significant. There have been other illnesses besides coronavirus where the amount of initial exposure was related to the amount of problems that person had to the disease, as well as the rate of death of the disease. So this is something that I'm watching really, really closely as the data is coming in, and we really need accurate data as far as outcomes when we can look at, how the person contracted it. Was it contracted out in the community at large without a known source, or was it contracted at home from someone that had previously had the illness? Something else that you're seeing quite a bit talked about that I think is important to evaluate is the doubling time. This has been attributed incorrectly to the disease maybe not being as severe as people think. I just heard the other day, I believe it was Dr. Burke, that was saying that the doubling time is not as rapid as we initially thought. Therefore, we think that the severity of this pandemic may not be as severe as initially forecast. But as we discussed earlier in this episode, the problem is that you've changed the input parameters. You've changed the system away from just its natural normal state. In New York City and throughout the entire United States right now, you have people that are staying at home, not aggregating together in large groups, not going to restaurants, basically not living your life at all how you previously lived it. So of course you would expect that the doubling time is going to go down because you've fundamentally changed how people interact with each other. When you change those interactions, you're going to change the doubling rate. For instance, say that we took every single person and moved them 5 miles apart from each other. You would expect the doubling rate to go to 0 because without any contact between people, there's no opportunity for the virus to be exchanged. When I hear people say stuff like this, it makes me really, really wonder, if they truly have a complete grasp of what's going on, because it seems so obvious that if you do something that has an intended effect, for instance, you put people on quarantine to slow the disease transmission, and then you turn around and say, well, the disease transmission is slowed, therefore our models are incorrect. That's such a faulty assumption that, it's almost laughable. I don't know if, to laugh or to cry when I hear people say stuff like that, but it does show you how easy it is to get lulled into a false sense of security if you only consider the number and you don't consider, everything going on, around the number. So I think the last thing I want to touch on for this particular episode is the length of time now that is being projected by governments around the world for how long we could be, on quarantines or lockdowns. Just yesterday in the United States, President Trump moved the goalpost from essentially the 1st of April to the 30th of April. So we're going to continue all the social distancing guidelines that were in place in the United States until that period of time. Individual states, however, we're actually seeing them ratchet up the restrictions beyond the federal level. In Florida, they actually have roadblocks apparently where they are checking people coming in from out of state to try to prevent the spread of disease. Weeks ago, if you go back to some of our initial broadcasts, at that point in time, we were saying, if we really want to shut this down, we have to just shut down air travel because the principles that were preventing, spread from China and from Europe are the exact same as preventing spread from inside the United States. It makes no sense to have travel from the entire world shut down if the most infected population right now per capita, which is in New York City, is allowed to freely roam to the rest of the country. They do have right now a level 3 travel advisory from New York, New Jersey, and Connecticut telling people that they strongly advise them not to travel. but the airplanes are still moving, and there's not a flat out, ban at this point in time for people moving. So how do we reopen the economy? At what point in time, can we say it's now safe, to go out and about? Once you lock everyone down, just like we were talking about earlier, you've changed the parameter of the system. So if we start letting people roam out again, we're changing the parameters of the system again, and it's somewhat unpredictable, what's going to happen. This has been for a while one of my biggest concerns of quarantines in general is you're setting up a state that is not sustainable. How long are you going to keep that going? What are you going to do to change the system? There has to be some change to the system that prevents the infection from spreading. If you're not changing the system, it's just going to happen again. Vaccines could change the system. Maybe, hydroxychloroquine is going to change the system. Maybe new testing, ways that we have. Super short tests may allow us to have innovative ways of, dealing with stuff. Right now, Abbott is releasing a test that is going to take between 5 and 15 minutes. Maybe we can reestablish air travel, screen people before they get on an airplane. Maybe screen international travels before they get on in the international gateways and then in the United States when they get here. Right now, I don't think that there's any clear answer to how you can possibly end a lockdown or a quarantine in the United States. One other idea that I did have that I haven't heard talked about really at all yet, that a quarantine, if it was very universally applied, say we put the entire United States on a 3-week, quarantine, we could identify the people that were known to be infected. We could isolate those people and their family to try to, allow them to get better. And then we could adopt a strategy somewhat like we see in Asia, where there's very aggressive testing of people that develop any sort of symptoms. We do very extensive contact tracing, and then we isolate those people alone. The only way that I see us getting out of a quarantine type situation without, just having the same thing blow up again is some sort of method like that, where we can reset the system, do a quarantine to reset the system, where we can determine what everyone's infection status is. And then once we know what everyone's infection status is, we can put those people into treatment, and then we can very aggressively test and kind of adopt the same type of procedures as they've done in, say, Singapore, to try to prevent it from blowing up again. So I just want to leave you with those thoughts. This is obviously a very dynamic situation. It's constantly changing. We're getting more understanding. We're getting more data. And as time goes on, everyone's outlook is going to change, either for the positive or for the negative. It can really go either way. So, when you're looking at data, when you're looking at reports from other people, just be asking yourself, what else could this mean? How could this data be being used in a way that doesn't actually support what they're trying to say? Like I was saying earlier, when it comes to hospital discharges, is it actually that people are getting better and going home? Or is it just that you're seeing a massive increase in the number of hospital admissions? And so, on the flip side of that, you're also seeing a bunch of hospital discharges. Maybe there's other factors. Maybe they're discharging people from the hospital that would have been in there, but they're just trying to clear out the beds. And so they're releasing them earlier than they normally would to free up capacity. There's all sorts of different, scenarios that you can envision, but, think beyond the data. Think, all sorts of, every possible avenue that you can, and, just really start to question, because there's a lot of information that's put out there right now that simply does not support the conclusion that people are drawing from it. And now more than ever, I think it's become very important to be a critical thinker. So thank you for listening. Have a good night and be safe. Thank you for listening to the Gilman Wolsey podcast. We hope you enjoyed our show. As always, if you have information that you would like to share with us, or if you would like to come on our show, please contact us at COVID at gilmanwolsey.com. We're always looking for new perspectives and to get an idea of what's going on out there. Thank you. Have a good night and be safe.